Hey everyone, and welcome to this week's lecture on personality disorders. So, a personality disorder refers to a long term pattern of thinking, behavior, and emotion that is dysfunctional, extreme, and inflexible. It causes distress and it makes it difficult to function in everyday life. People with personality disorders find it hard to change their behavior or adapt to different situations, and they may have trouble sustaining work or forming positive relationships with others. Now, I want you all to pay very close attention to this week's lecture because there are a lot of times that out in the general public, we use these phrases and terms that are similar to personality disorders. And we're also very socially quickly to diagnose someone with a personality disorder. But the thing you must remember is that this is an enduring pattern of behavior. It does not stop, it is consistent, and it typically sometimes starts in childhood or somewhere in adolescence. So let's make sure that we pay very close attention to these symptoms and these factors because, again, they can become sort of, socially acceptable to say terms and things sort of like someone being a narcissist, even though they don't have narcissistic personality disorder. So the personality disorders are grouped into three different clusters. You have cluster A, which involve odd or eccentric presentation and include paranoid, schizoid, and schizotypal personality disorders. You have cluster B disorders, which involve dramatic, emotional, and erratic behavior and include antisocial, borderline, histrionic, and narcissistic personality disorders. And finally, you have cluster C disorders, which involve an anxious or fearful presentation and include avoidant, dependent, and obsessive compulsive personality disorders. So, personality traits are enduring patterns of perceiving, relating to, and thinking about the environment and oneself that are exhibited in a wide range of social and personal contexts. Only when personality traits are inflexible and maladaptive and cause significant functional impairment or subjective distress do they constitute personality disorders. The essential feature of a personality disorder is that enduring pattern of inner experience and behavior that deviates markedly from the norms and expectations of the individual's culture and is manifested in at least two of the following areas: cognition, affectivity, interpersonal functioning, or impulse control. The enduring pattern is inflexible and pervasive across a broad range of personal and social situations, and it leads to clinically significant distress or impairment in social, occupational, or other important areas of functioning. The pattern is so stable and it has a very long duration. Its onset can be traced back to at least adolescence or early adulthood. And also, the pattern isn't better explained by a manifestation or consequence of another mental disorder and isn't attributable to physiological effects of a substance such as, drug use, medication, exposure to a toxin, or any other medical condition. The diagnosis of personality disorders requires an evaluation of the individual's long-term patterns of functioning, and the particular personality features must be evident by early adulthood. The personality traits that define these disorders must also be distinguished from characteristics that emerge in response to specific situational stressors or more transient mental states, such as bipolar, depressive, or anxiety disorders. And you also want to include substance intoxication. So, we're going to get started with the cluster A disorder of paranoid personality disorder. The hallmark of paranoid personality disorder is a pervasive distrust and suspiciousness of others, and tendency to interpret actions of others as deliberately demeaning, threatening, and malevolent, as evidenced by four or more of the following: suspects that suspecting that others are exploiting, harming, or deceiving him or her. They're preoccupied with doubts about trustworthiness of others. They're reluctant to confide in others because of concerns that the information will be used against them, They interpret benign comments or events as demeaning or threatening. They bear grudges, perceive attacks on their character, and responds with anger or counterattacks. Or they believe their partner is unfaithful. The primary characteristic of this condition is a chronic and pervasive distrust and suspicion of others. Other symptoms of paranoid personalities could be feelings that are like they're being lied to or deceived or exploited. They might believe that their family and romantic partners are untrustworthy or unfaithful. They have outbursts of anger in response to perceived deception. They're often described as cold or maybe jealous and sometimes secretive and serious. They're overly controlling in their relationships in order to avoid being exploited or manipulated. And they look for hidden meanings and gestures in conversations. Paranoid personality disorder is thought to affect between about 1.2 to 4.4% of US adults. And individuals with paranoid personality disorder are at a greater risk of experiencing depression, substance abuse, and agoraphobia. Next in cluster A is schizoid personality disorder. So, schizoid personality disorder is characterized by a pattern of detachment from and indifference to social relationships and a restricted range of emotions, as evidenced by four or more of the following. They neither desire nor enjoy close relationships, including family. They usually choose solitary activities, have minimal interest in sexual experiences, and experience little pleasure in activities. They lack close friends or appear indifferent to praise and are cold, detached, or affectively flat. So, people with schizoid personality disorder tend to have very few relationships. They rarely date. They don't go out often. They don't marry. And the symptoms of the disorder may also make it difficult to work in positions that require a lot of social interaction or people skills. So, the other things that people with schizoid personality disorder might experience is a preoccupation with introspection and fantasy. They might sense indifference to praise and affirmation, as well as to criticism or rejection, like they really just don't care. There's little or no desire to form close relationships at all. They're very indifferent to social norms and expectations. Um, they don't enjoy anything that has to do with socializing. And again, they're often described as cold, uninterested, withdrawn, or aloof. I want to also point out the difference between schizoid personality disorder versus schizophrenia. When we see these, skits at the beginning of a lot of these mental disorders, we consider that they might be the same. But there are differences between schizoid personality disorder and schizophrenia, of course. So while schizoid personality disorder is considered one of the schizophrenia spectrum disorders and shares some common symptoms with schizophrenia and schizotypal personality disorder, there are some important distinctions that separate those two from the others. Those with schizoid personality disorders rarely experience paranoia or hallucinations. Also, while they may seem aloof and distant during conversations, they do make sense when they speak, which differs from the difficult to follow speech patterns that are often demonstrated from people with schizophrenia. Overall, this type of personality disorder is believed to be relatively rare, and it tends to affect more men than women. Next, we'll talk about schizotypal personality disorder, which wraps up the cluster A disorders. The hallmark schizotypal personality disorder is a pattern of deficits in social and interpersonal functioning, marked by discomfort with a reduced capacity for close relationships, as well as peculiarities in cognition, perception, ideation, appearance, and behavior, as evidenced by five or more of the following: ideas of reference, odd beliefs like telepathy or clairvoyance, unusual perceptual experiences, odd thinking in speech. For instance, their speech is vague or they're overly elaborate. There's suspiciousness and paranoia, inappropriate or constricted affect, odd behavior or appearance, lack of close friends, social anxiety associated with paranoid fears. So, individuals with schizotypal personality disorders experience extreme discomfort during interpersonal reactions. Now, unlike in social anxiety disorder, where an individual is likely to grow more comfortable with time, individuals with schizotypal personality disorder remain uncomfortable even when they're interacting with the same people in the same environment over and over again. This disorder also involves distorted thinking and eccentric behavior, which tends to push people away and create even more isolation. So that's something that I want you to see in terms of a big difference between schizotypal personality disorder and schizoid personality disorder. Schizotypal personality disorder individuals are very eccentric. So they're going to be dressed sort of oddly in terms of not what you would deem to be culturally acceptable. And they do that to even push people away more from themselves. There's also a few other things like superstitious beliefs. Sometimes individuals with schizotypal personality disorder are superstitious or preoccupied with paranormal phenomena that are outside of what would be expected in their culture. They might think they have special powers or even like magical control over others. Like they'll think that the reason their coworker is leaving early is because they wished upon them, some type of illness, and they think that they did it. They may also believe that their behavior prevents a harmful outcome, like thinking that they can prevent bad things from happening by placing an object in a certain place. They also may experience perceptual alternations, such as hearing someone mumbling their name or sensing that a spirit is present. And their speech, it might be vague or incoherent at times. They may use strange phrases or talk in a way that confuses others. They also might appear constricted and show little emotion during interactions. They might have unusual mannerisms, such as unkempt matter of dress. And typically, clients with this disorder may wear ill fitting clothing or, again, bizarre clothing combinations like winter boots with shorts, and may be unable to participate in normal give and takes of a conversation. They might occasionally express sadness over their lack of close friendships, but their behavior suggests that they have little desire for close connections. And they often interact with people that they have to, but they prefer to keep to themselves at most times. They also might experience transient psychotic episodes during times of extreme stress, which last like minutes up to hours, but they don't have regular hallucinations or delusions such as those with schizophrenia. So now we're going to get into those cluster B disorders, those that are dramatic, emotional, and erratic. These disorders are ones that typically you've heard about and are talked about more socially. So, starting with antisocial personality disorder, features of this disorder include a pervasive pattern of disregard for and violation of the rights of others since at least age 15, as indicated by three or more of the following: repeatedly committing unlawful acts, deceitfulness, lying, conning, impulsivity and failure to plan ahead, repeated physical fights, assaults, disregard for the safety of others, irresponsibility, for example, failure to keep a job or honor financial obligations, and there's a lack of remorse. The individual must be at least 18 years old, and there's evidence of conduct disorder before age 15. There are also a number of defining symptoms of antisocial personality disorder. Clients with ASPD may begin displaying symptoms during childhood, and such behaviors might include fire setting, cruelty to animals, and difficulty with authority. Often they have legal problems resulting from failures to conform with social norms and a lack of concern for the rights of others. They act out impulsively and fail to consider the consequences of their behavior. You'll often see a lot of aggressiveness and irritability that lead to physical assaults. They have no empathy, and they often have poor or abusive relationships with others and are more likely to abuse or neglect their children. And they frequently lie and deceive others for personal gain. These characteristics often lead to major difficulties in many life areas, and at its core, the inability to consider the thoughts, feelings, and motivations of other people can lead to a harmful disregard of others. As adults, the order can be destructive to both the person living with it and those who come into contact with them. People with APD are more likely to engage in risk taking behaviors, dangerous activities, and criminal acts. Those with this disorder are often described as having no conscience and feel no regret or remorse for their harmful actions. I know most of you might be thinking this, but it could be often said that um, individuals that have very long histories with um, unlawful acts, especially as it pertains to hurting others, or even suspects that are involved with murder cases, things like that. A lot of times, what you're going to see is antisocial personality disorder, and of course, you're going to be thinking about like people who we might call a sociopath because of that, you know, um, or I'm sorry, a psychopath because of that, having no conscience and feeling no regret or any remorse for their actions. For prevalence, according to the DSM, it's about 0.2 to 3.3% of US adults, and it affects more men than it does women. There are concerns that have been raised that the diagnosis may at times be misapplied to individuals in low SES or urban settings in which seemingly antisocial behavior may be a part of protective survival strategy. Because of this, it's possible that the prevalence of this disorder can be overstated. Then we have BPD, or borderline personality disorder, which I know a lot of us have heard of before. Borderline personality disorder is a pattern of instability of mood, interpersonal relationships, and self image, as well as significant impulsivity, as indicated by five or more of the following: efforts to avoid abandonment, intense, unstable relationships characterized by idealization and devaluation, unstable self image, impulsivity in two areas that are potentially damaging, such as spending, sex, or substance abuse, recurrent suicidal or self mutilating behavior, affective instability, chronic feelings of emptiness, inappropriate anger, transient paranoid ideation, or dissociative symptoms, which are stress related. BPD can interfere with the person's ability to enjoy life, achieve fulfillments in relationships, work, or school. And it's because it's a personality disorder, someone may not show signs of it until their personality develops, with most diagnoses occurring in clients over 18 years of age. Symptoms of borderline personality disorder can appear and create significant problems in the following areas: those behaviors. So it's associated with the tendency to engage in those like shopping sprees, excessive drug or alcohol use, engaging in promiscuous or risky sex, or binge eating. They're also more prone to engage in self harming behaviors, again, such as the cutting, burning, and attempting suicide. Emotional instability is really the key feature. And most of the time, this is what we as clinicians see the most. They feel like they're on an emotional roller coaster with quick mood shifts, going from like okay to extremely down within a few minutes to a few seconds. Those changes can last from minutes to days and are very intense. Anger, anxiety, and overwhelming emptiness are common as well. And then the other thing that we tend to see with this is people with BPD have these intense relationships with loved ones, characterized by frequent conflicts, arguments, and breakups. It's associated, this is because it's associated with an intense fear of being abandoned by loved ones, which leads them to difficulty with trusting with others and attempts to avoid real or imagined abandonment and putting strains on relationships. It's also very common for someone with BPD to have a favorite person or someone they feel like they can't live without. These are the clients that you'll see in sessions at times where they'll come in and they'll idealize you. They'll talk about how great a clinician you are, how great everything is going. And when you say something that they disagree with, or if they're having a bad day, they'll just totally shut down on you and change their opinion of you and demean you within a few seconds to a few minutes. They also are very preoccupied with self-image, so they have difficulties related to the stability of their sense of self. They'll report a lot of ups and downs on how they feel about themselves. One moment feeling good, the next moment they feel like they're bad and even evil. And then again, those stress related changes in thinking. So, under really extreme conditions of stress, people with BPD may experience changes in thinking, including paranoid thoughts, for example, that others may be trying to cause harm to them, or even dissociation, feeling spaced out, numb, or that they're really not in their body. So, not everyone with BPD experiences every symptom. Some people have few of them, while others experience most, if not all of them. It is estimated that about 1.4% of the adult population has borderline personality disorder, with roughly three-quarters of the diagnoses occurring in women, although it is suggested that this is due to the high rates of misdiagnosis in men and women having more help-seeking behaviors. BPD has typically been thought of as an adult onset disorder. However, it has been found in treatment settings that symptoms in adolescents as young as 12 or 13 can meet full criteria for the disorder. Next, we have histrionic personality disorder. The features of histrionic personality disorder include excessive emotionality and attention seeking, as evidenced by five or more of the following. They're uncomfortable when they're not the center of attention. Their sexually seductive or provocative behavior, rapidly shifting and shallow expressions of emotion. They use physical appearance to draw attention. They speak dramatically but without substance. They exaggerate emotions. They're easily influenced by others, very suggestible, and they consider relationships closer than they actually are. Other symptoms can include, they'll display exaggerated symptoms of a weakness or an illness, and it's almost like they're constantly performing as if they're always on stage, either socially or in private with others. They have a lot of fleeting moods, opinions, and beliefs. There's this need for others to witness their emotional displays for validation or for attention, and they can often use threats of suicide to manipulate others. Histrionic personality disorder is one that tends to co occur with other personality disorders, particularly borderline personality disorder, narcissistic, and dependent personality disorders. There's a great deal of overlap between BPD and HPD features, so much that some experts believe that histrionic personality disorder may not even be distinguishable from borderline personality disorder. For instance, they share similarities such as rapidly shifting and reactive emotions, being associated with impulsive behavior, and characterized by a strong expression of emotion. Although borderline can be characterized by attention seeking, manipulative behavior, and rapidly shifting emotions, it's distinguished by self-destructiveness, angry disruptions in close relationships, and chronic feelings of deep emptiness and identity disturbance. All right, and to wrap up cluster B, we have narcissistic personality disorder. This disorder involves a pattern of grandiosity, a need for admiration, and lack of empathy, as indicated by five or more of the following: a grandiose sense of self importance, preoccupation with fantasies of greatness, power, brilliance, or beauty. They believe that they're special. They need excessive admiration. They have a sense of entitlement. They're interpersonally exploitative. They use others, for example. They lack empathy. They're envious of others or think that others are envious of them, and they're arrogant and haughty. Some other symptoms that you might see with clients with narcissistic personality disorder is that they'll exaggerate a sense of their own abilities and achievements. They are constantly needing attention, affirmation, and praise. They have a lot of fantasies about attaining success and power. And there's always a sense of entitlement and an expectation of special treatment. You might be able to recognize whether someone has narcissistic personality by looking for some of those signs. And people with the disorder are typically described as, again, conceited, self-concerned, and self-centered. This is because they imagine themselves as superior to others, and they often insist on possessing items that reflect a successful lifestyle, even if they don't live it. Despite this exaggerated self image, they are reliant on constant praise and attention to reinforce their self esteem. As a result, those with the disorder are usually very sensitive to criticism, which is often viewed to them as a personal attack. There are estimates that about 9.1% of US adults experience at least one type of personality disorder during any given year. For narcissistic personality disorder, between 0.5 and 5% of adults have it. Among adults aged 18 and older diagnosed with narcissistic personality disorder, 50% to 75% of them are men. Finally, we get to the cluster C disorders, which are of the anxious and fearful sort. Starting with avoidant personality disorder, characteristics of avoidant personality disorder include a pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation, as evidenced by four or more of the following. They avoid occupational activities due to a fear of criticism, disapproval, or rejection. They're generally unwilling to get involved with others unless certain of being liked. They're restrained in intimate relationship due to fear of shame or ridicule. They're preoccupied with concerns of rejection and criticism in social situations. They're inhibited in new situations due to a sense of inadequacy. They view themselves as socially inept or inferior, and they're reluctant to take risks or try new things because of potential embarrassment. So there are a lot of other symptoms involved with this. There's the anhedonia, as I explained before, so a lack of pleasure in activities. They're usually seen as a people pleaser because they want to avoid conflict. You might see that these clients turn down promotions because they fear that they won't be able to live up to whatever the responsibilities of that new promotion is. They're extremely self conscious and they typically fail to initiate social contact. Social anxiety disorder and avoidant personality disorder share similar symptoms and genetics, and avoidant personality disorder is sometimes characterized as a more severe form of social anxiety. It can seem similar to social anxiety disorder with some overlap in symptoms. However, they are distinct conditions and have different causes. Like avoidant personality disorder, social anxiety is a type of anxiety that causes people to feel that they will be judged or rejected by others. However, social anxiety is driven by high level of anxiety, while significant feelings of worthlessness can cause avoidant personality disorder. While they are distinct, a person can be diagnosed with both conditions at the same time, so they can co-occur. Avoidant personality disorder affects about 2.5% of the population, with roughly equal numbers of men and women being afflicted. Next, we have dependent personality disorder, which is characterized by a pervasive and excessive need to be taken care of. That results in submissive and clinging behaviors, difficulties making decisions, and fears of separation, as evidenced by five or more of the following: difficulty making decisions without advice and reassurance from others, needs others to assume responsibility for most major areas. They have difficulty expressing disagreement due to the fear of loss or approval. They have difficulty doing things on their own. There are excessive attempts to obtain support from others. They're uncomfortable when alone due to feelings of not being self sufficient. And they urgently seek a new relationship when a close relationship ends because they're preoccupied with fears of being alone. While studies of the co-occurrence, also known as comorbidity of the personality disorders, is very limited, there are some researchers that have examined the overlap between dependent and borderline personality disorder. For instance, there is a 2014 study that found a 20% comorbidity rate among subjects who had both BPD and dependent personality disorder. The prevalence of these comorbidities could be because of the features of dependent personality disorder, which are very similar to borderline personality disorder. For example, People with borderline personality disorder experience rejection sensitivity, and they have a tendency to feel desperate even at the slightest perceived rejection. Individual dependent personality disorder may react similarly to criticism or perceive abandonment by loved ones. And then lastly, we have obsessive compulsive personality disorder. The hallmark of this disorder is a preoccupation with orderliness, perfectionism, and control, which results in inflexibility and inefficiency, as evidenced by four or more of the following: preoccupation with details, rules, or schedules, such that the major point of the activity is completely lost; perfectionism that interferes with task completion; excessive focus on work and productivity to the exclusion of friendship and leisure; over conscientiousness and inflexibility about morals and values; inability to discard worn out and worthless objects; and reluctance to delegate tasks to others, or stingy with money and rigid and stubborn. The primary symptoms of obsessive compulsive personality disorder focus on an obsession with perfectionism and a need for control. Other symptoms you might see are they act restrained or restricted with their emotions. Again, that inflexibility or rigidity in adherence to rules. They create order and lists for tasks. They might be extremely dedicated to their work. They have trouble giving things to others, and they have difficulty empathizing with others and or maintaining intimate relationships. So let's talk about the differences between obsessive compulsive personality disorder and obsessive compulsive disorder. So, obsessive compulsive disorder is defined by the presence of true obsessions, so an irrational thought or idea that continually repeats, or and compulsions, an irrational behavior performed repeatedly. These behaviors can occur together or on their own, and they interfere with the person's quality of life and ability to function. While obsessive compulsive personality disorder, on the other hand, the personality traits are not directed by uncontrollable thoughts or irrational repeated behaviors. While people with the personality disorder often engage in rigid behaviors that may be centered on following procedures, they don't have the same intrusive thoughts and overwhelming compulsions that people with OCD do. The symptoms of obsessive compulsive disorder tend to fluctuate in association with the underlying level of anxiety. So people with OCD engage in behaviors as a way to deal with feelings of fear, anxiety, and uncertainty. This means that their symptoms may be less severe during times when they're experiencing less anxiety. Because the personality disorder is a personality disorder that's defined by inflexibility, the behaviors tend to be persistent and unchanging over the long term. Their symptoms do not fluctuate depending on anxiety levels and are present in almost every area of the person's life. It is also possible for the two conditions to occur at the same time. Some research suggests that around 20 to 30% of people with obsessive compulsive personality disorder may also have obsessive compulsive disorder, and around 52% of people with obsessive compulsive disorder have at least one comorbid personality disorder. I hope that this was helpful for you and that it clears up some of the differences between these disorders and some of the social ways that we tend to talk about them. Remember, when you're diagnosing an individual with any disorder, you're looking at the criteria and seeing what they fit. That will conclude the lecture for this week on personality disorders.